Block feeding is a common breastfeeding management practice. It involves feeding the baby from the same breast for a set number of feedings or hours. Mothers often try block feeding when they have an oversupply of milk. This can be a challenge for both mother and baby. If you think you have signs of an oversupply, block feeding may be a useful option. So ask your health professional to check your milk supply, as well as the baby's positioning and latch. Your health professional may suggest fully draining the breast by expressing with a breast pump before you start a block feeding cycle. This can help prevent blocked ducts and mastitis. When your baby shows feeding cues, offer him the same breast for as long as he wants, as often as he wants within the block of hours you have set. If he sleeps for a few hours and wakes to feed in the same block cycle, continue to feed off the same breast. Once the next block starts, switch to the other breast for all feeds. Continue this cycle. Every mother and baby pair are unique, and in some cases, they may need to adjust the length of the block feeding cycle. The aim is for your breast to adjust milk production to balance supply and demand, reducing the challenges of oversupply. Make sure your health professional continues to monitor your breastfeeding progress as your baby grows.